Gerd, Things You Should Know, Questions and Answers by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Gerd, Things You Should Know, Questions and Answers. This book will help you understand, revise and have a good general knowledge and keywords of Gerd. Chapter 1. 1. What is Gerd? Gerd is a gastroesophageal reflux disease. 2. What is reflux? Reflux is a return or a flow back. 3. What causes acid reflux? Acid reflux is caused by the weakness of the lower sphincter of the esophagus. 4. Is Gerd a common condition? Yes, Gerd is a common condition. 5. Can infants have Gerd? Yes, infants can have Gerd. 6. What are the signs and symptoms of Gerd? The signs and symptoms of Gerd include chest pain, heartburn, laryngitis, difficulty swallowing, pain swallowing, regurgitation, sleeping difficulties, a hoarse voice, etc. 7. What is heartburn? Heartburn is a burning sensation in the chest due to acid reflux. 8. Is Gerd the same as heartburn? No, Gerd is not the same as heartburn. 9. Can you have Gerd without heartburn? Yes, you can have Gerd without heartburn. 10. What is laryngitis? Laryngitis is the inflammation of the larynx. Chapter 2. 1. What is regurgitation? Regurgitation is when food travels from the esophagus to the mouth. 2. What is the function of the esophagus? The esophagus allows food to pass from the mouth to the stomach. 3. Is scleroderma a risk factor for Gerd? Yes, scleroderma is a risk factor for Gerd. 4. What is scleroderma? Scleroderma is a chronic autoimmune disease that thickens and hardens the skin and causes scar tissues. 5. Is being overweight a risk factor for Gerd? Yes, being overweight is a risk factor for Gerd. 6. Is pregnancy a risk factor for Gerd? Yes, pregnancy is a risk factor for Gerd. 7. Why do pregnant women experience Gerd? Pregnant women experience Gerd because of the pressure exerted on the abdomen. 8. Is smoking a risk factor for Gerd? Yes, smoking is a risk factor for Gerd. 9. Is alcohol a risk factor for Gerd? Yes, alcohol is a risk factor for Gerd. 10. Is coffee a risk factor for Gerd? Yes, coffee is a risk factor for Gerd. 11. Is late night eating a risk factor for Gerd? Yes, late night eating is a risk factor for Gerd. Chapter 3. 1. Should a person with Gerd lay down immediately after eating? No, a person with Gerd should not lay down immediately after eating. 2. What kind of foods and drinks that causes reflux should be avoided? Foods and drinks such as fried foods, fatty foods, onion, alcohol, chocolate, caffeine, etc. 3. Is eating large meals frequently a risk factor for Gerd? Yes, eating large meals frequently is a risk factor for Gerd. 4. Are medications risk factors for Gerd? Yes, some medications are risk factors for Gerd. 5. What medications can cause Gerd? Non-steroidal anti-inflammatory medications can cause Gerd. 6. Is gastroparesis a risk factor for Gerd? Yes, gastroparesis is a risk factor for Gerd. 7. What is gastroparesis? Gastroparesis is a delay in emptying the stomach. 8. Is lupus a risk factor for Gerd? Yes, lupus is a risk factor for Gerd. 9. What is lupus? Lupus is a chronic autoimmune inflammatory disease. 10. Is rheumatoid arthritis a risk factor for Gerd? Yes, rheumatoid arthritis is a risk factor for Gerd. Chapter 4. 1. What is rheumatoid arthritis? Rheumatoid arthritis is a chronic autoimmune disease that causes inflammation of the joints. 2. Can Gerd lead to dental problems? Yes, Gerd can lead to dental problems. 3. Can Gerd lead to lung problems? Yes, Gerd can lead to lung problems. 4. Can Gerd cause bad breath? Yes, Gerd can cause bad breath. 5. What are the complications of Gerd? The complications of Gerd include esophageal ulcer, esophageal stricture, esophageal cancer, Barrett's esophagus, pneumonia, bronchitis, postnasal drip, asthma, etc. 6. What is esophagitis? Esophagitis is the inflammation of the esophagus. 7. What is asthma? Asthma is a chronic illness that causes inflammation in the respiratory system and makes breathing difficult. 8. What is bronchitis? Bronchitis is the inflammation of the bronchi. 9. What is pneumonia? Pneumonia is an infection of the lung. 10. How is Gerd diagnosed? Gerd is diagnosed by X-ray, endoscopy, esophageal manometry, pH probe test, biopsy, etc. Chapter 5. 1. What is endoscopy? Endoscopy is a medical procedure that allows the visualization of inside the body. 2. What is esophageal manometry? Esophageal manometry is a test that measures the rhythmic contractions and force of the esophagus during swallowing. 3. What is biopsy? Biopsy is a medical procedure that involves the removal of a sample of a tissue for testing. 4. Can Gerd be treated? Yes, Gerd can be treated. 5. What are the treatment options for Gerd? The treatment options for Gerd are antacids, proton pump inhibitors, and medications that reduce the production of acid, prokinetics, surgical options such as Link's device, fundoplication, transoral incisionless fundoplication, Stretter procedure, etc. 6. What are antacids? Antacids are medications that neutralize acids. 7. What are prokinetics? Prokinetics are medications that help quickly empty the stomach. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding Gerd.